I was working initially in Kotak Mahindra Bank as a senior manager. When I was traveling to the office, I met with an accident. It was a road traffic accident. So there were injury on my spinal cord. We had rushed to the local hospital. Then they shifted to the Spurs hospital for the further MRI and CT. So I got injury. It was confirmed. So then it was like surgery after 4 5 days of my accident.
ಮತ್ತು ಆಪ್ರೇಷನ್ ಎಲ್ಲ ಆಯಿತು. ಆಮೇಲೆ ಅವ್ರು ದೊಂಬಳೂರಿಗೆ ಬರ್ಕೊಟ್ರು. ಇನ್ನೊಬ್ಬ ದಿಲೀಪ್ ಸರ್ ಅಂತ ಇದ್ದಾರೆ, ಅವರು ಸರ್ಜರಿ ಮಾಡಿದ್ದಿದ್ದು. ಅವ್ರು ಅಲ್ಲಿಗೆ ಬರ್ಕೊಟ್ರು. ನಮ್ಮ ಫ್ರೆಂಡ್ ಅವ್ರ ಕಝಿನ್ ಅವ್ರು ಅಲ್ಲಿಗೆ ಬರ್ಕೊಟ್ರು. ಆಮೇಲೆ ಅಲ್ಲಿಗೆ ಹೋದ್ವಿ. ಅಲ್ಲಿ ಟೈಮ್ ವೇಸ್ಟ್ ಆಗೋಯ್ತು. ಆಮೇಲೆ ನಮ್ಮ ಭಾವನ ಮಗ ಒಬ್ಬರು ಶರಣ್ ಸರ್ ಈ ಥರ ಇದ್ದಾರೆ, ಅವರು ನಮ್ಮ ಭಾವನ ಫ್ರೆಂಡ್ ಒಬ್ರು ಇಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ರು. ಅವ್ರು ಹಂಗಂತ ಹೇಳಿದ್ರು.
So this patient Kodandram, he had a road traffic accident, two-wheeler, and he had injured his back, and he was taken to another hospital where a friend of mine treated him. And he had, because of the injured back, he had paralyzed from waist down, both legs and things like that, and he was not able to move ever since the accident. So then he went to that hospital. They did an MRI and CT scan, and they found that a bone was broken in the back, and that was compressing his spinal cord, because of which he had got damage to the spinal cord. So what they did was they went in and operated him. They put screws in the back, they decompressed his spinal cord and made sure that it was all aligned and stable. So and then he was in a post-op period, and within about 10-15 days of post-op period, he was shifted here for neuro rehab. Fundamentally, he came in for neuro rehab. And when he came in itself, he was having some pain in the leg, a little bit of tightness, which normally comes in much later, but in the patient's second month, third month. And they had already started some tablets, which is the normal thing that we do, and we were hoping that he settles down with that. But that thing just started increasing, and he would have severe pain in the leg, and especially at night, his leg would get stuck like this, go inside and get stuck, and he would howl in pain, and you would not allow anybody to touch him, and you can't pull out his leg, and it was like somebody just fixed his leg like that. And we were thinking, how is it happening so quickly, whatever it is. And then there's this tablet called Liofen or Baclofen, and that's one of the best drugs to give for this. And for a small set of patients, they don't agree with this drug. And the moment I increase it to 20 milligrams, he would be sleepy all the time. And there's a small subset of patients who have this drowsiness all the time, so we couldn't increase it any further. So when we have this problem, then we have an alternate to this, wherein we put a tube into the spinal cord directly and deposit the injection of this drug directly into the spinal cord, bypassing this barrier. That's what we do. So I suggested this to him. So, and this is done usually by a procedure called intrathecal baclofen pump implantation. We actually implant a pump in the abdominal wall, and the tube goes into the back. This pump is very expensive. So before we implant this pump, we have to justify to ourselves and the patient that it's worth doing it. So we do something called an ITB trial. We do a trial of this where we mimic the actual procedure, but the pump is outside. So I suggested this to the family, and because he was desperate, he said, let's try it. And we did that, put a tube into the spinal cord, and the tube was connected outside to the same syringe infusion pump. And you won't believe it, in just with 50 micrograms of the drug, not milligrams, micrograms, he was pain-free, spasms went away, and he was very happy. By the time we had implanted the pump, this whole process took a couple of weeks from the time he came in. He had started moving, developed some movement in his, both his feet a little bit, left more than right, a little bit of movement around the knee joint. And the moment I gave him this 50 micrograms of the drug, when I implanted the pump, this movement went away. Now, it's very unusual. Normally, when we implant the pump, the starting dose is usually 100 micrograms. Because he was very sensitive, I had given him only 50 micrograms. Now 50 also turned out to be too much for him. It's like a pediatric dose. So then I told him I'll make it 25 micrograms. That's the least dose that the pump allows in an adult. So I put 25 micrograms, and then he was okay. It's been 2018 I implanted the pump for him, and from then on the pump, the dose has hardly increased. From 25 we came to slowly to 40, 45. Now he's at about 53. That's it. It is the lowest among all the pump people that I have put. And with that, he's really reached a stage where the spasms are gone, and and he's able to now walk with elbow crutches. So I think it's a great tool to have. It's called Interthinking. So one of the processes of neuromodulation surgeries that I do, and it's a great thing. And though I put it for spasticity, this also helps relieve the pain. So one day he actually asked me, am I pump dependent? And then I said, we only know if you are not out of the drug. And during the pandemic time, once the drug had gone off, there was a little bit of struggle in identifying the drug because everything was locked down and things like that. And he got the spasm back. So he knows that it is still there and the drug is helping him, but it's made a big difference.
The days which I passed, it was in nowhere to somewhere, I can say, because from an zero power to walking independent and in walker, it's a too hard journey to travel, because the efforts which have been put, if I put in 50% efforts, the efforts has to be from the doctor and the therapists. Okay, I cannot say it's from me only the 100%, because there were so many complications would be there, so many things would be there to look after that. They would be checking on the small changes in the body or small changes in the motor nerve or sensory nerve, how you could add value to the thing. 2 or 3 of the therapists, initially the Priyanka ma'am was there. She was a senior therapist here. She was the one who took care of me initially. It was a very hard job to get my muscle powers or something which magical happened with her, along with continued with Deva Prasanna and Kaleshwari. These were the 3 where I am today, and for all of these 3 people, Sharan Sir and Pratibha ma'am are the backbones.